Morning, everybody. This is Mary Lynn Collins. I am with the United County Cornell Cooperative Extension Ag Team. I am coming to you tonight from Oneida County, and I'm pleased to be presenting tonight's program, or hosting tonight's program rather, courtesy of Cornell Cooperative Extension's Livestock Program Work Team. We will get underway here shortly. We're just letting a few more participants log on and get situated. If you haven't already, I wanted to point out that our livestock program work team, we do have a website. If you haven't checked it out already, it can serve as a great resource for livestock producers across the state. That's www.ccelivestock.com. I would encourage you to take some time after tonight's program, or when you have spare time, to check out that website. A lot of great resources on there, and it's a great way to stay in touch with our upcoming events for all livestock producers, whether you're beef, sheep, poultry, swine. We cover it all there, so check that out sometime. I will try to remember to put that website link in the chat box as well. But I wanted to thank you for joining in. Feel free throughout tonight's presentation to raise your hand if you have questions, or unmute yourself and ask the question directly. Or if you're comfortable using the chat box, certainly put your question in the chat box and I will be monitoring them, and we will have a question and answer session at the end of tonight's presentation. Our guest speaker tonight is Dr. Shannon Carpenter. She is a field veterinarian with New York State Ag and Markets, and she is present with us tonight to speak about different vaccination styles and types, and also to cover some cattle diseases that we may experience in our different beef operations. So, Dr. Carpenter, if you're ready, I will stop sharing my screen and allow you to take over the helm. Thanks for being here tonight.
You're welcome. Okay. Share screen. There we go. All right. So I am Dr. Shannon Carpenter. I am a field vet, as she said, with New York State Department of Agriculture and Markets, Division of Animal Industry. I grew up on a dairy farm. A little background here. I grew up on a dairy farm in Chautauqua County, and went to vet school at Purdue University. Graduated in 2001, was in private practice for 13 and a half years, strictly large animal, mostly dairy and beef. And in 2014, a job opportunity came up with the state, so I jumped on it. And now I have been with the state since the fall of 2014. And have enjoyed it. The things get crazy now and then. They seem to be the last few years, things have been really crazy with the state, but just a lot of extra work and whatnot. But we're all plugging through and trying to help farmers and producers the best we can. So if you have any questions, like Marilyn said, please feel free to put a comment in the chat and we will get to it when we get to the end. So I'm going to talk to you a little bit about some vaccinations, herd management programs, and then go through a few emerging cattle diseases that we have seen here in New York State. Vaccination basics. Why do we vaccinate? We typically are vaccinating to protect our animals from disease. There are two main types of vaccines. There are modified live and there are killed vaccines. And this could be for either viruses or bacteria. Your core vaccines, you sometimes will hear the term core vaccine. That's determined by your core vaccines for one farm may be different than core vaccines for another farm. But it's determined by the impact of the disease, the likelihood that your animals could potentially be exposed to the disease. And then if your animals are unprotected, what is the risk that they could potentially become exposed? That's how we kind of come up with the core vaccinations. And most of the time, your main core vaccines are pretty much the same across the board for most farms. Why do we give the vaccines? We want to mitigate the risk. We want to try to protect our herd. The vaccines act as an insurance to protect our herd from becoming ill, from having a disease go through the entire herd and costing a lot of money, possibly losing animals, all things that we really do not want to happen. Different factors that would warrant vaccinating for certain things is if your likelihood of exposure is high, if your risk of the unprotected exposure to the disease is high, if your vaccine is effective. Having an effective vaccine is very important. And also the cost of the vaccine is the cost of the vaccine justifiable to be used? You may have a vaccine that is extremely expensive, but you are not having the disease on your farm, or you're not necessarily bringing animals into your farm that would potentially bring it to your farm. You may not want to spend the extra money for that particular vaccine. The goal of the vaccination, we want to protect your herd from any harmful diseases for health, economic, and welfare reasons. Obviously, we should always be thinking about animal welfare when we're doing vaccinations or any procedures to our animals, as well as the economic impact that it's going to have. The purpose of vaccination is to allow your immune system to develop some sort of a memory and to create immune cells that will remember the particular bacteria or virus that has been injected into them. If they have created those immune cells, the next time they are exposed, it should trigger their immune system to recognize the disease and create more of those immune cells to fight off the infection. Every time you vaccinate and or booster an animal, that should trigger the immune system to recognize the disease and to create more of those immune cells. We always need to remember that vaccinations do not always equal absolute protection. They do not always prevent infection, but they do aid in preventing clinical infection. So you can have an animal that is vaccinated and is exposed to a disease that may become infected, but not show any clinical signs. They could be subclinically infected. But the vaccine is protecting them from actually showing those clinical signs, which is good because your animal is going to have less of a setback in their life because of that. Clinical infection can still occur in vaccinated animals as well. This usually happens when the immune system is overwhelmed or if the animal is immune compromised. So being immune compromised, whether they have another disease process going on, or times during calving. Calving is usually a time frame in a bovine's life when they are immunocompromised, or their immune system is also overwhelmed at that point in time. If you are giving a lot of vaccines at the same time, that can also overwhelm the immune system and you can become ill, or the animal, I should say, can become ill. It's no different than if you were to go get a flu shot, a flu vaccination. And I hear many times people say that I went and got the flu vaccine and I still got sick, or I got sick right after it. The shot gave me the disease. Well, that's not always the case. The flu vaccine is a killed vaccine, so A, it can't get you sick, but B, you would probably were already fighting something subclinically, and by getting the vaccine, you overwhelmed your immune system, and hence you got sick with whatever disease you were fighting. Same thing happens with animals. Vaccine types. We have modified live vaccines, we have killed vaccines, combination that have a little bit of both. And included in the modified live and the killed vaccines are what we call bacterins. Bacterins are basically vaccines for your bacterial diseases. They're a little bit different than your vaccines for viruses, um, because they do need to be boosted more frequently. You do not get the duration of immunity with bacterins like you do with the vaccines for the viruses. If it's an attenuated bacteria for for the bacterins, that's usually considered to be a modified live bacterin. And if it's killed, then it would be a killed bacteria or killed bacterin. The chart that I have up here on the right-hand side shows some characteristics of differences between modified live and killed vaccines. And some of this can possibly help you decide which type of vaccine you may want to use in your herd. Modified live vaccines tend to have a longer duration of immunity. So one dose will last you for a lot longer. There's typically multiple strains within a modified live vaccine. So BVD, for example, there's typically 2 to 3 strains of BVD in most of the modified live virus vaccines. Needing to booster, they do need to be boosted, but you can get away with a longer period of time or needing to be vaccinated or boosted less frequently. The amount of antigen within the vaccine is a lot less. So with the amount of antigen being less, you have less vaccine reactions. However, some of the modified live vaccines can actually cause some disease, like IBR, for example. The IBR portion can sometimes affect the ovaries on cattle. That's why on the modified live vaccines, it states to not give to pregnant animals unless they have had the vaccine while they were open. Your killed vaccines have a shorter duration of immunity, meaning that you need to vaccinate more frequently. They have a narrower spectrum of coverage. Usually there's only one strain or maybe 2 strains of BVD, for example, in the vaccine. You do definitely need to booster the vaccine in a relatively short period of time. They do have more vaccine reactions because there is a lot more antigen, a lot more vaccine or virus particles in the vaccine. But overall, it is safer to give. So they do not cause disease like a modified live vaccine may. Um, the modified live vaccines basically are a non-disease causing version of the virus or bacteria. So it's a piece of the virus or a piece of the bacteria that doesn't necessarily typically cause disease. This piece of virus or bacteria will actually replicate in the animal typically without causing disease. Sometimes it can. The replication of the vaccine organism then allows the immune system to develop its immune response. And you can create protective immunity with one dose of vaccine. Boosters are recommended primarily because even though you can get protective immunity with one dose, not all animals will respond to every vaccine that you give them or every dose of vaccine that you give them. So it is wise to booster. All your killed vaccines, they do not contain any live virus or bacteria. It's basically a dead organism or a specific piece of the organism that's critical to the function of the disease-causing virus or bacteria. There is no replication within the body with the killed products. And the problem with them is that the immune system does not necessarily develop the protective immunity with one dose, so you definitely need those boosters. It's imperative that you have the boosters to get protective immunity. Otherwise, you are wasting your money. Combination vaccines. I know Cattle Master is is a good example. They contain some modified live components and some killed components. One thing to remember with these types of vaccines is you can protect against the modified live portion with one dose. However, that killed portion of that vaccine does still require a booster. So that is important. Revaccination and boostering, many times these terms are used interchangeably, but they do have slightly different meanings. In any case, vaccines should be given at least 3 weeks apart. This is highly dependent on the vaccine, and you really need to read the label to know how long. Some vaccines are 3 weeks, some are 6 weeks, but and anywhere in between. So definitely read the label. Revaccination is typically the term that's used for modified live vaccines. The reason for this is if we say we are vaccinating 100 animals, our goal is to reduce the number of non-responders in a group. So if we go through our herd of 100 head and we give everybody 1 round of vaccine, approximately 90 of those animals will respond to the vaccine. You're going to have 10 animals approximately that don't respond. So those 10 animals are still unprotected. By giving a second round, a revaccination to the entire herd, because you're not going to know who is unprotected, you're going to capture 9 more of those 10 animals that were unprotected. So you're going to end up with 99 animals protected and 1 animal that's unprotected. So you can effectively say that you have herd immunity. Boosters, we typically talk about boosters with killed vaccines. This is giving the vaccine more than once to create your protective immunity that can't be achieved with 1 dose. The chart on the right shows your first dose, your initial vaccination, and you can see how the titer will rise somewhere around 14 days or so after vaccine, and then it starts to go down. If we call that level 1, that is not your protective immunity. When you hit your 21 days and you give that second dose, that will cause the immune system to recognize the vaccine, your booster or your antibody level skyrockets and goes up to that level 2, which is your protective immunity. And that's what you need to protect your animal when it is exposed to different diseases. So that's why it's very important to give that booster, because that first dose, you're going to see that slump in the immunity until you give that booster. Some of the common cattle vaccines that are used, I'm gonna quickly run through some of the respiratory viruses and bacteria, some of the reproductive viruses and bacteria, Clostridial bacteria, and then I have a short list of a few others, and there are many more. I have narrowed this down to a select chunk of vaccines because there are many on the market. Our main respiratory viruses are going to include IBR, which is infectious bovine rhinotracheitis, PI3, which is parainfluenza virus, BRSV, which is bovine respiratory syncytial virus, and BVD, which is bovine viral diarrhea virus. All 4 of these cause respiratory infections, pneumonia, upper respiratory infection. All of them can weaken the immune system to make an animal more susceptible to other viruses and bacteria, including things like mycoplasma, Pasteurella, Histophilus, etc. And as I'm going to talk about here in a minute, the BVD also causes reproductive and digestive issues. So it's your bang for your buck on preventing different issues in your animals is truly enhanced when you're vaccinating against BVD. The respiratory bacteria, the most common ones are Mannheimia hemolytica, Pasteurella maltacida, and Histophilus somni. All of these typically are secondary infections. Uh, Usually the animal will have a primary viral infection, and the secondary infection will come on as a bacterial infection. Pasteurella, incidentally, is most commonly referred to as summer pneumonia. That's usually when we see that one is in the summertime with a outbreak. Um, Histophilus also likes to affect other organs like the brain, so they can end up with meningitis as well. One that I don't have on here is mycoplasma, which there are some vaccines for mycoplasma that are questionable, I guess, as to their efficacy, depending on which strain of mycoplasma may be on your farm. Reproductive viruses include IBR and BVD. Both of these will cause abortions, infertility, birth defects. BVD also creates persistently infected animals. If you look at, I could do a whole presentation on BVD, but if you look at the chart here on the right, you have a calf in the middle that's persistently infected. I like to think about those calves as being like Typhoid Mary or Pigpen from the Peanuts with his dust cloud all around him, constantly shedding virus. So if this calf becomes exposed to a cow that up in the left corner there that says it's a pregnant female whose fetus may become infected, if she is unvaccinated, there is a very high chance that her calf will become persistently infected in utero. The only way an animal can become persistently infected is to become infected in utero. Once they are born, they can only get the acute infection. If she is vaccinated, she may fight the infection and protect herself from the acute infection, and she may also protect her calf. But there is still the chance that her calf, if she does not protect her calf, then her calf could potentially still become a persistently infected animal. Up in the top right corner, there is a cow and a calf that are born healthy, not persistently infected. The only thing that they can get is the acute infection from that persistently infected animal. So they could end up with pneumonia. The cow could end up with infertility issues, etc. The calves down at the bottom left corner, if they are exposed to a persistently infected animal, they can develop pneumonia, diarrhea, etc. Usually a high fever. If they are unvaccinated, which many times calves that go through this with an acute infection, they often are young enough where they have not been vaccinated yet, and maybe they don't have good enough immune protection from the colostrum that they had received from the maternal antibodies. The bull down in the right corner, he can also become acutely infected if he's exposed to a persistently infected animal. And then he can go through and he can expose the cows while he's breeding, which can cause more infertility and abortions. So eliminating the persistently infected animals from the herd by vaccinating against BVD and also testing and calling persistently infected animals is definitely a wise idea. The reproductive bacteria would include leptospirosis or lepto. That can cause abortions, and they mainly get exposure through deer, rodents, different wildlife out in the pastures, whatnot. If they urinate in a puddle, or if you have a pond that may not be a free-flowing body of water, a good inlet and outlet, that could potentially harbor lepto and expose your cattle when they drink. Brucella abortus or brucellosis. otherwise known as Bang's disease. New York is considered to be a free state from brucellosis. However, we do still see some brucellosis here and there in dogs. We have seen it in swine a few years ago. And we do still see responders when animals are being tested to possibly be exported into Canada. This causes abortions. It is zoonotic, so humans can get it. The bison and elk in the wild out west seem to be our wild reservoir for it, and that's why it continues to persist in the United States. Many people used to vaccinate for it. I do not see as many people vaccinating for brucellosis as when I first graduated from vet school. So that's kind of gone by the wayside a little bit. Clostridial bacteria. I've listed 4 probably of the more common ones. Clostridium shovii, which is blackleg, causes a lot of muscle necrosis. The animals well, actually, as the muscle is dying, there's gas that's produced and it gets trapped underneath the skin. So it makes the skin almost feel like bubble wrap. You can feel the popping of the bubbles underneath if you push on it. It is a very unique disease. Most Clostridium organisms, once they are in the soil, they are there forever. There's no getting rid of them. I know there is a farm here not too far from me in Chautauqua County that when I was a student in undergrad, I went out with a vet and diagnosed blackleg. The vet diagnosed blackleg. And that farm will always have blackleg on their farm. They do not have any animals there currently, but if they ever do get animals on the farm, I know I will stop and forewarn them because they could definitely have an issue. Clostridium hemolyticum is otherwise known as red water. This causes a lot of kidney and liver damage. All these Clostridium bacteria release a lot of toxins. This is usually something that is facilitated by liver flukes. New York was not typically known to have a lot of liver flukes. Quite a few years ago, just in certain pockets, but I feel like I hear more and more about liver flukes. So that is one that if you are in a swampy or a flood type zone, and have pastures and floodplains, I would definitely consider that testing to see if you may have liver flukes, or check out your livers when animals go to slaughter, because those animals, their livers could have liver flukes in them, causing the livers to be condemned. Clostridium tetani or tetanus, also another deadly Clostridium disease. Tetanus loves to grow where oxygen is scarce. The most common history that us vets hear when we are getting a call that could be potential tetanus is we have steer, or some calves that were banded about a week to 10 days prior. That is probably the most classic history that I can think of. I think every single tetanus case that I saw, they had been banded within 7 to 10 days. And were, turned out to pasture, or even in the barn where it was a pack type situation that may not have been cleaned out frequently. Obviously, they've got tetanus in those areas. Anytime you are banding, anytime you're castrating, I would recommend giving a tetanus vaccine, but banding especially. I give all of our calves, when I band our own, I give all of them a tetanus vaccination. Clostridium perfringens causes digestive issues, primarily scours. So that would be another potential one to vaccinate against. The core vaccines are going to be determined by the likelihood that your animals are going to be exposed and the risk of what if they are unprotected and become exposed. Uh, these are going to be diseases that greatly impact your productivity, your health or welfare of the animals. Um, Unprotected exposure can potentially be disastrous. Uh, and you definitely want to have minimum protection if possible. So what I would consider to be the respiratory core vaccines would be the IBR, PI3, BRSV, and BVD types 1 and 2. Primary reason I would say that these should be a core in most everybody's vaccination protocol is viruses. The only treatment for viruses is supportive care. We do not have the luxury of having um, antivirals for cattle like we do in human medicine. They would be very cost prohibitive. Reproductive core vaccines, again, the IBR, BVD, and Lepto. Clostridium, if you have any Clostridium issues on your farm or nearby, I would definitely recommend the blackleg, red water, tetanus, Clostridial perfringens. Scour issues in calves, Clostridium, especially if it's a scour with sudden death, a lot of bloating. If you have calves that bloat frequently, I would definitely say you want to probably add in some Clostridium vaccines into your core. And as I said before, if you're banding your calves, especially, I would definitely include tetanus in your core Clostridial vaccines. Some other vaccines to think about would be pink eye, which can cause ocular lesions or ulcers on the eye. There's a lot of different thoughts on that. Typically, pink eye is caused by a Moraxella bovis or Moraxella bovaculi. Um, Pink eye can also be caused by leptospirosis. It can be caused by mycoplasma. So there are other things that can cause it. However, if you are able to treat quick, or if you are able to culture the eye to see what actually is growing, as to what the exact cause is, that may help you decide which vaccine might be the best vaccine to incorporate into your vaccination protocol. Scours, some of the common scour vaccinations include rotavirus, coronavirus, E. coli, Clostridium perfringens, and Salmonella. There are two different types of vaccines for scours. One goes into the cow to help boost her colostrum so that the calf receives immunity through the colostrum. Those typically need to be given at least twice, usually 3 to 4 weeks apart. So that would involve, for most beef cattle, running them through the chute a couple times. They also make some vaccinations that are oral for calves, and you can give those as soon as the calf, basically as soon as the calf is born and able to swallow, preferably before they receive any colostrum, would be the time to give those. Another couple of vaccines that I do, I've seen local farms vaccinate for these, and these two diseases are not necessarily as common around here as they would be in some more southern states. But trichomoniasis is a sexually transmitted disease that causes abortions and fertility issues. It's caused by a protozoa. And vibriosis is a bacterial disease that causes abortion and infertility, as well as uterine infections. But these are not commonly seen around here. They definitely could be seen around here, but we do not hear about them very frequently, thank goodness. What So many people ask me what products should you use, or what vaccines should you use? What should your protocol be? Hold a second. We got to get a piece of paper here for the little guy. There we go. Um, there is no cookie cutter vaccine protocol. If you look like over on the right hand side, there's Zoetis Select Vac protocol. Um, all of the drug companies have their own protocol, but as a vet, I was in private practice for many years, and there is no cookie cutter protocol that's going to fit every single farm. You need to include the coverage for the core vaccines on your farm that matches your system's risks and logistics as to when you can run cattle through the chute. You also need to consider how effective the vaccine is, the price, and some of it comes down to personal preference. Uh, do you prefer running them through the chute more frequently, less frequently? Do you prefer to have vaccines that you have to mix up, versus already mixed? Do you prefer to use one select company's vaccines as opposed to using a combination of vaccines from multiple companies? Um, as vets, I know we all have our personal preference. There are many vaccines that have the core viral vaccines in them that are equivalent. So you do need to talk to your private vet, and you need to develop a plan specifically for your herd. Sit down and figure out which issues you may or may not be having on your farm, and what the more important vaccines would be for your herd. And I guess before I go on, I will share a story when I was in private practice, and this occurred at a dairy farm. Uh, they were using a couple of us as veterinarians, and they kept they were having some issues, and every time, like, the other vet would go, and then I would go, and the other vet would go, and they would bring up some issue that they were having. Well, is there a vaccine for that? And yeah, there are vaccines for it, and you'd mention what the vaccine might be. Well, they were coming up with their own vaccination protocol. I got called out one day for an they'd had a couple abortions on cows that they had just dried off. It was within 48 to 72 hours of drying the cows off, they were aborting calves. And they wanted me to test the calves to see what the problem was so that they could add in another vaccine to protect the cows and protect the calves from aborting. So I went and collected samples on the calves, and I gave them a piece of homework. I wanted them to write down all the vaccines they were giving and when they were giving them, right from the time these animals were calves on up, until the cow was having her next calf. And when they sent me that list, this was before I had results back from the lab on the calf, I realized that we had a major problem. They were using 3 different vaccines that all included the IBR, PI3, BRSV, and BVD portions in them, as well as leptos. So they were giving all 3 of those vaccines on the same day, along with a scour vaccine, which usually has about 8 or 9 components to it, as well as an E. coli vaccine to protect against E. coli mastitis, as well as it was either like multimin or Muci or something like that, and dry treat, and whatever else they were giving. So basically what happened is they completely overwhelmed the cow's immune system by giving them too many things at one time. Their immune system could not function. It's like eating Thanksgiving dinner and then thinking about where that piece of pie is going to sit in your stomach because you're so full you can't do anything. So that's basically what they were doing, and the cow's way of surviving this was, we need to get rid of the calf so we can survive. And that's why they were dumping their calves. So definitely talk to your vet and sit down with them. to develop that plan specific for your herd. Deworming programs are definitely important. Um, especially with cattle that are out on pasture all the time. Uh, it is wise to do fecal examinations to determine what parasites might be present, what the numbers are. If you have very few parasites, you may not want to deworm at all. But knowing that you don't have many parasites is important. There are different types of dewormers. The oral, the poron, injectable, and then there's also the long-acting injectable. Some are more convenient to use, some are more costly. Some have a broader range of activity, some have some residual activity. So for example, obviously the porons are fairly convenient. They rank number 1 in our chart here for being convenient because you don't even need to touch the animal. You just need to get close enough to squirt that down their back. Um, the cost of them is moderate. Uh, Utilization, you're relying on that dewormer to get absorbed properly, and you're relying on the blood levels to actually get high enough to actually kill off the parasites that you're looking to kill. They do typically have a broad spectrum of activity, and their residual activity would be moderate. Looking at the injectables, convenience, moderate, because obviously we have to catch those animals up and actually inject them properly. Most of the dewormers are labeled for sub-Q use, so you do not want to be giving them intramuscularly, or you're not going to get the effectiveness out of the vaccine that you would like. The cost of the injectables is a lot higher. They typically have a decent spectrum of activity, and residual activity you may get, 30 days or so out of, say, ivermectin injectable. The long-acting injectable would be your long range, which has up to 5 months against lungworms. The oral convenience, convenience is not there. Wrestling cattle's heads to try to shove something in their mouth sucks. uh, it's not fun. So that option is there, whether it's the pills or it's the liquid, however you want to do it. Fighting with them, it takes a lot more manpower. They are cheap though. They are cheap. Residual activity, basically the oral dewormers are in and out in 24 to 48 hours. That's your residual activity. And their spectrum of activity is typically a lot narrower. They're going after specific parasites. And typically it's the adult parasites. You're usually not necessarily getting all of the larvae that may be formed inside the gut. Some other parasites would be your external parasites. Right now, lice. Lice are very common right now. We have multiple different types of lice for cattle, biting and sucking lice. Most commonly, you see a hair loss along their back, maybe their neck, their shoulders, their brisket, sometimes their face, depending on which type of lice. Mites also seem to be a little more prevalent in the wintertime. It seems like when animals commingle more because they're trying to stay warm or they are in a barn, that's when you tend to see it. The mites will have some crusty areas. A lot of times you'll see that like at the top of the udder on the cows or along both sides of the tail head will be a common spot for mites. Sometimes you will see it on their head or neck or face. Ticks. Ticks like to get into areas where there's less hair and also where the skin is a little bit thinner. So inside the ear seems to be a common spot, around the back of the ears, in the groin area, the armpit area of the front legs. Those would be some common areas, but the ears tend to get hit uh pretty frequently because as an animal puts its head down to graze, if the grass is up to the point of where their ears are, and you have ticks that are questing, looking for a critter to feed on, their ears are in the exact location, and those little ticks like to basically crawl right off that grass and go right into the ear and find themselves a meal. And then we have flies. So fly control should definitely be on your external parasite control program as well. Some of the internal parasites, coccidia, which would be your Eimeria. Coccidia is treated very differently from many of your other uh, internal parasites. Typically, we use something like prevention would be your decox, your Bovatec or Rumensin. And for treatment, people are usually using oh goodness, Corid. Name just flew out of my brain, but Corid is typically the treatment of choice. Then we have your brown stomach worms like your Ostertagia, your lungworms, Ardictiocollis, tapeworms, Monesia, liver flukes, fasciola. Liver flukes require a special treatment. There's the ivermectin plus that has the chlorulon in it. That is what you need for liver flukes. Or there's at least one valbazen has some coverage against liver flukes, but you have to give it quite frequently. Your injectable dewormers typically do not get tapeworms, neither do the porons, so you need an oral dewormer for tapeworms. So this is why it's important, if you have an animal that you're suspecting internal parasites, to know which parasites you actually have, so you know which dewormer you're going to use. Most of the internal parasites have a 3-week life cycle. So from the time the egg is laid and it goes through the larvae phase and becomes an adult inside the animal is typically 3 weeks. So dewormers, knowing what parasites you have before you treat. Most of the any of the dewormers, none of them get all of the parasites, and none of them get all the stages of parasites. But we also like to have a little bit, we call it refuge. So you have a few parasites that are left over to hopefully stimulate their immune system to fight off the rest. So it is okay to have a few parasites. You just don't want it to get overboard. So talk to your veterinarian and decide which dewormer or dewormers might be best depending on what you have. Processing calves. When you're processing calves, it is always a good idea to have some sort of identification in them. Farm tags are awesome because you can see them from afar, and knowing who they are and which mother they belong to can be very important. If you happen to have a mother that dies suddenly, then you know who you have for a bottle baby if the other cows are not taking care of it. I also recommend, and I guess it's my duty as state vet, I need to push my official tags, which would be your 21 state tags, which are the metal clips, or the 840 RFID tags, which will become the official tag in the United States, possibly by next year. And I always say that those are very important to have in the ears, whether the animals are on your farm or if you are sending them somewhere to a livestock market, to another farm. because we can actually trace those tags. It's definitely important if animals get out, um, say we have a natural disaster, a tornado, a storm where fence lines go down because of trees, animals get out. If they have official identification in their ear and they're caught up a few miles down the road, uh, we can trace that tag and say, yes, that animal came from that farm. So, it's very easy to be able to trace those. Um, Castrating calves should be in the processing, um, protocol, whether it's by banding, cutting, crushing. I On our calves at home, we have about 50 head of beef, and I band everything unless we have had a couple that have ended up with a retained testicle. Luckily, it was just up in the inguinal canal, and I let those calves go for a couple weeks until they were strong enough to um, be sedated properly so that I could uh, do a little extra surgery, cut that testicle out and get it out safely. Crushing with the Burdizo, I know some people like to do that when they are a little older, but um, I have had experience with some bad experiences with people crushing for castration, and I've had fertile steers, which shouldn't happen. And I have also seen people crush um the scrotum down the middle where the blood supply for the scrotum is, and had testicles hanging with no scrotum because they killed the scrotum. So my thought on castration, which is my personal preference, is if there are two testicles laying on the ground because I cut them out, then I know it's castrated. Or if I have two testicles below my band that dry up and fall off, I know it's castrated. But that's my preference. Everybody has their own. But like I said, I've had some bad experiences with the crush method. Dehorning, there are multiple ways to dehorn. Burning, cutting, and using the paste. I know a lot of dairy farms have gone to using the paste. However, beef cattle, that can be a very difficult process. I mean, hopefully we are breeding more and more for polled animals, but the paste will burn. So if the mother happens to lick the calf's head, you will burn her tongue with the paste. And we don't want that to happen. So typically with beef cattle, it's usually a burn or a cut. Um, of those two, I would prefer burn because you can do it if you can do it when the calves are younger. Younger's always better. Uh, Sedate them a little bit, or at least provide them with a nerve block, and possibly even um some other pain relief, like a pour on Banamine, or um some other oral medication like aspirin or something that can be used for some pain mitigation. Cutting, I always warn people to be aware, especially if they're out on pasture with flies, because that can become a good area for flies to uh, lay their eggs and have a maggot situation. So that's preferably done during cooler months. And quite honestly, cutting, when we have burning options, the cutting option is a lot, looking out for animal welfare. It's a lot more brutal on the animals. Any of your protocols, I definitely advise you to work closely with your vet. Develop a plan for your farm for vaccination and deworming. If it's not convenient for you and for when you are working your cattle, then you're not going to do it. So make sure that it's a protocol that is convenient for you. Don't make it fit your farm, make it unique to your herd. Don't take some cookie cutter. If your vet hands you a cookie cutter vaccination protocol, and say, well, I don't have the time this time of year to run my cattle through the chute for this. So can we adjust this somehow? Have that conversation with your vet. I know some vets, some do have kind of a standard protocol that they start with, but if it doesn't work for you, make sure that they know that. Have a conversation with them about it. Record keeping, very, very important. Anytime you are vaccinating, deworming, treating your animals, you should be keeping records of that. All vaccines, dewormers, medications, antibiotics have some sort of slaughter withhold time. And that needs to be recorded so you don't send an animal to the auction or to slaughter before that slaughter withhold time is up. These records can be handwritten or computerized. At the state, we have some treatment record books that we have available for farms, for the producers. Excuse me. You can use a calendar and you can use a computer. There are computer programs out there. The one thing I will say about the treatment record book and some of the computer programs is they have all the necessary information. Our treatment record book definitely has all of the necessary information that is required for if you had a drug residue and the FDA was coming in to take a look at what you gave an animal, when you gave it, how much you gave it. It has all that necessary data in there. Any treatment records should be maintained for at least 2 years. And treating the animal is important, but keeping the records is probably more important, especially if there is a residue. I'm going to stop right here for a minute. Does anybody have any questions? What do we have in the chat? Anything?
Let's see.
No, doesn't look like it yet.
Nope, nothing in the chat. I do have a follow-up question for you while others think of their questions. Getting back to the core vaccine packages, when you're working with your vet and having this conversation, what tools or resources do the vets use to determine those clostridial components? Are there certain regions of New York that are known to be to have this in the soils? Or I'm just kind of wondering, how would you really drill down further to determine clostridial components?
So clostridial components, the vets that have been in practice for a while, you start to learn what you have in your area. And bloating calves, if you have calves that bloat all the time, you likely have Clostridium perfringens in your soil. So that might be where you might want to incorporate a clostridial vaccine. Tetanus, irregardless of whether tetanus has ever been diagnosed on your farm or not, I would definitely vaccinate against tetanus. Tetanus is a horrible disease. And the typical treatment for most clostridials is penicillin. However, by the time you are starting to see clinical signs, it's usually too late. So, it's a horrible death for tetanus. Some of the other ones, it's going to be, what the vets have seen in the area. Unfortunately, a lot of the clostridial vaccines, other than they do make the Clostridium perfringens type C, D, and tetanus as there's 3 of them in that one vaccine. And then you have some of your other clostridials that are like an 8-way, 7-way, 8-way, your alpha. There's alpha, there's cavalry, but it includes a whole bunch of the clostridials. Does that answer your question?
Yes, it does. Thank you so much.
You're welcome.
And since then, we've got a few more follow-up questions in the chat. Perhaps you could share with us where producers could get that treatment record book.
Okay.
The other questions are related to castration in animals. For example, what age do
Yep.
you recommend the right age for
So,
castrating?
so, for the castration question first, uh, I don't know if any of you have ever read any articles in some of the beef magazines from Dr. Mark Hilton. He was one of my professors at Purdue. And when I took the beef class my junior year, he basically said the soonest that you can castrate a bull calf is if it is being born backwards and its hips and testicles are outside of its mother and its head is still inside. So that's the soonest you can do it.
Okay.
On our farm, um, because I work full time, my time getting over to the farm is somewhat more limited. So what our protocol is if a calf is born from Sunday through Saturday, I am definitely typically at the farm on Sundays. So from Saturday to Sunday, those calves all get castrated on Sunday. And so I don't do them the day that they are born. I usually make sure that they're at least 24 hours old, make sure they're going to live, make sure that they're up, they're nursing, everything else. But I try to do it as young as possible. Um, Landon, um, honey, stop. Um, and I mean, it's no different than having a baby boy circumcised. Like the younger you do it, the less painful it's gonna be. So that's definitely when I would recommend doing it. Um, as for the record book, Carlos, Dr. Scrafford, if he does not have those, let me know and I can drop one in the mail to you. If anybody else wants one, I will have my email address on here towards the end. You guys can feel free to shoot me an email and let me know, and we can either get them mailed out to you or we can let whoever the state vet is in your area know and they can get one to you. Um, advantages and disadvantages of an older castration against a young one. So, I had a client, I'm sure many of you know Ted Card, who was the president of the New York Beef Producer Association here last year. When I was in practice, I did his vet work, and he decided that he was going to do a little on-farm trial. So every other bull calf that he had born, he would band one and he would save one for me in the fall. He would band one, save one for me. Had a scale, so he ran those animals across the scale around weaning time in the fall. So he knew how much they weighed. The calves that had not been castrated yet weighed a little bit more than the ones that were castrated right off the bat. However, after I got done castrating them, those calves had quite the setback. And when he ended up sending them to market, the ones that were castrated at the younger age actually were heavier than the ones that were done later on. So, I mean, that just shows that the pain and the stress that they go through as they get older is a lot more than doing it when they are younger. It may not fit, it may not fit your situation to do them when they're younger. I know some people like to keep some of them back because they may want to keep one for a breeding bull, which is, you know, if you need to do that, you need to do that. It's just looking at the animal welfare standpoint of it. Doing it younger is definitely less stressful for them. Um, lice, mites, ticks, flies. What do I recommend using? Uh, there are a number of products, and that really needs to be worked out with your vet. Some people are using like dust, some people are using the pour on There's poron, the poron dewormers that do get some of the forms of lice and mites. There, some of the injectable dewormers will get some of the lice and mites, especially the sucking lice. The ticks and flies, sometimes the insecticide ear tags work. As for flies, there are multiple different methods to I know we use multiple different methods for flies. uh we have some of the dust bags. We have sometimes if the flies are really bad, we do some of the pour on fly control where you pour it down their face so the flies aren't um bothering their eyes so much. Um yeah, there's a few of those types of products. There are parasitic flies that you receive a shipment of every month or so, and you plant them in different areas. Those flies actually feed on the larvae of the parasitic or of the flies that are causing harm to your animals. If that helps a little bit. Let's see, are there any vaccines that are particularly harsh that we should be aware of when giving, especially to calves? Yes, there are some vaccines that are harsh and more harsh on calves. And most of the time for calves, we're typically not vaccinating them until they are at least 2 months old, depending on the vaccine. The salmonella vaccines, the clostridial vaccines, those ones can definitely be a little bit harsher. The clostridial vaccines can be harsh on any age animal. A lot of times our clostridial vaccines will actually leave some sort of a injection site lesion. So it is good to be sure that you're giving that under the skin so you're not damaging that muscle in the neck. When cows, why do cows eat diatomaceous earth? Does it help with parasites? So diatomaceous earth is considered to be an organic method of deworming animals. The method that it uses to rid the body of parasites is basically it's an irritant inside the intestine, and it's supposed to irritate the parasite so the parasite will let go and get passed on out. Does it help? Sometimes maybe, but if you have a heavily infested animal, then probably it's going to need something more than just diatomaceous earth. I have never seen diatomaceous earth really cure an animal that had a really heavy parasite load. All right, I guess that catches us up on those questions.
Yep. Great questions, everybody. Thanks for
Yes.
contributing. We'll let Dr. Carpenter continue on with their presentation, and there'll be time for more questions at the end.
So I'm gonna go on, maybe. I'm frozen. There we go. I'm going to go on and discuss a few tick-borne and parasitic-borne diseases that we seem to be seeing more and more of here in New York State. The diseases are anaplasma, babesia, theileria, and epizootic hemorrhagic disease. All of these diseases are reportable. The two websites that are listed, the first one is basically how to report an animal disease that is reportable, and the second one is actually the reportable disease list that we have here in New York. It lists all the different species, but bovine, there's a section just dedicated to cattle. So reportable diseases are diseases that we feel are huge economic burdens and possibly highly contagious, high mortality rate, high morbidity rates, and also sometimes have some resemblance to some of the foreign animal diseases, which can be concerning if we are seeing diseases that resemble a foreign animal disease. Anaplasma, we'll start with. That is an intracellular rickettsial bacterial disease called Anaplasma marginale. It is spread by ticks. 17 different species of ticks at this point in time are known to transmit anaplasma. The disease actually the bacteria will actually infect the red blood cells. So you have a tick feeding on blood inside right here. We have a picture of the ear. So the tick has direct route transmission right into a capillary to be able to suck blood and basically regurgitate or burp up some of what it has eaten in the past and throw some of that anaplasma right back into the bloodstream and infect animals. This disease is seen worldwide. It tended to be seen primarily in the southern states. However, as our winters up here in the north are becoming less and less severe, it seems, over the years, I think a combination of that and ticks have become, I think they are evolving through evolution to be able to tolerate the winter months a little bit better. So we are seeing it more and more in the northern states. Another method of transmission is iatrogenic transmission, so contaminated equipment. Anybody want to guess how an easy way for contaminated equipment to share this disease with others? Feel free to unmute and share your thoughts. And I can give you a quick story of a case that I did see. Any ideas? No?
Probably from reusing needles.
Reusing needles is probably the biggest method of transmission. When I was in practice, I actually had a farm in Pennsylvania because I'm so close to the border. I was licensed in 2 states, and they were going through an expansion, and they purchased some animals from down south, and they had not been tested before they came up here. They used oxytocin in the parlor, and for the first few days that those new animals were there, they were using oxytocin in the parlor on these animals to get them to let their milk down and relax in the parlor. And they were reusing the needle, so that the first positive animal that came through, I am envisioning they gave her a shot and that dirty needle got stuck back into the bottle of oxytocin with a drop of blood that was infected and basically infected the entire bottle of oxytocin. So every animal after that that got a dose of oxytocin became infected. So yes, needles are cheap. Needles are, depending on the size, what brand of needles, 5 to 10 cents a piece. Needles are cheap as compared to the cost of an animal. Some fascinating facts about anaplasma. Calves tend to be more resistant to getting clinical disease. They are not resistant to getting the infection, so they tend to become your asymptomatic carriers and the reservoir for future infections. Disease severity in your animals that are less than a year old is where you get your subclinical disease that you're not actually seeing. It may be affecting the animal internally, but you may not be seeing outward clinical signs. The 1 to 2 year olds, you may see some moderate to severe disease. Animals that are over 2 years old, it's typically severe to fatal. There is a pre-patent period, so from the time a tick bites the animal and infects them until the time that they show clinical signs of infection is typically 15 to 36 days. With the iatrogenic spread, it can be 5 days. It can definitely be a lot shorter. And then after that, it becomes either peracute, acute, or chronic. The peracute animals, which are typically your older animals, they tend to die within a few hours of showing clinical signs. The acute animals, typically you have loss of condition, decreased production, they'll be off feed, loss of coordination. The loss of coordination is because, uh, as we said, this bacteria is infecting the red blood cells. Your red blood cells are very important for carrying oxygen throughout the body. So as red blood cells are being killed off because this bacteria has invaded them, the red blood cells can no longer carry oxygen effectively throughout the body. So the animals start to become ataxic and appear that they are drunk or losing coordination. Um, if you exert these animals and try to herd them together to say make them go through the chute or try to gather them up from the pasture, if they are exerted, they will become breathless. They will also have brown urine. They end up becoming jaundiced. They start out as having very pale mucous membranes, as the picture shows here on the right side. And then their mucous membranes will become extremely jaundiced and yellow. They typically have temperatures up to 106 degrees Fahrenheit, and they do abort their calves. And you can see this picture of this blood slide. You can see the little dark purple dots that seem to be on the margin of the red blood cells. That is typically where you see the Anaplasma marginale. There's also in other parts of the country, there's Anaplasma centrale, and as its name implies, it usually is in the very center of the red blood cell. So diagnosis is typically with a blood smear. If you have an animal that is, or animals that are unthrifty, Cornell actually has what they call a bovine chronic ill thrift weight loss plan for blood. So you can send in vials of blood and they will perform a test. And it does include these primary diseases that I'm going to be talking about this evening. So that would be that's usually the most cost-effective way to have them tested is to go through that weight loss plan because you get a bunch of tests done at a cheaper cost. Treatment, there are antibiotics available to help treat these animals, and you must discuss that with your veterinarian for what they recommend. And there's no vaccination for anaplasma here in the United States. Babesia. Babesia is a tick-borne disease, a protozoal disease that also affects the red blood cells. There are 7 different species of Babesia. This typically, if you have Babesia in a herd, it's usually high morbidity. So a lot of animals are sick and high mortality. A lot of animals are dying. If you have had it in your herd for a while, if you have some animals that are carriers, asymptomatic carriers, and you happen to bring in a new animal into the herd, your naive animal that you have brought into the herd is going to be the one that is more apt to become infected and have clinical signs and die. Cattle tend to be the primary host and reservoir for Babesia. We've also seen it in reindeer, elk, and caribou. My experience with Babesia was actually in elk. A captive elk farm here in Western New York had an issue. Lost 3 of their cows one summer. This disease can also become zoonotic, especially if the animal has had a splenectomy. So if they have had their spleen removed, whether it's a human, a dog, a cat, any species like that, they would be more susceptible to babesia. Which is concerning if you know you have it in your cattle. That means that you probably have ticks in the area that are carrying the disease. So you'd be more susceptible. Distribution, again, has been more common in the southern states, but we are seeing it more and more up north. Transmission is primarily the Rhipicephalus exodes and the I can never say this one right. It's the Asian longhorn tick. I'm gonna put it there. Put it there. The Longicornis tick. And again, the iatrogenic spread with reused needles, unclean surgical equipment, so dehorning equipment, castration equipment, anything like that. Biting flies can also potentially spread it. Incubation period is 2 to 3 weeks if they are bitten by a tick, or 4 to 5 days if blood transfer from your reused needles. Clinical signs, also a high fever, start out with pale mucous membranes that end up going into jaundice. Increased heart rate and respiratory rate, because again, our red blood cells are being killed off because they are infected and they cannot carry oxygen like they should. Decreased appetite, decreased production, weakness because we're not carrying oxygen throughout the body. Lethargy, they feel tired. Neurologic signs, also from the anoxia, from not being able to carry the blood or the oxygen throughout the body properly. These tend to start out with having diarrhea early in the course of the disease and constipation towards the end. There's on the blood work, you'll see hemolysis, so dying red blood cells or dead red blood cells, along with anemia. So lack of red blood cells. On postmortem, when you open these guys up, everything is yellow. Everything, the fat, the organs, everything has a yellow tinge to it. The blood is typically very thin and watery, and it does not clot like you would expect. The spleen will be very dark, like a really dark purple color, and it's pulpy and very friable. I mean, you put your fingers on it. Usually the spleen, you put your fingers on it and you have to push pretty hard to get your fingers to go through it. But with this, it's very fragile. Your fingers will just mush right into it. The gallbladder will be distended, which is common with a lot of different illnesses in cattle. And lungs will have a lot of edema, and the brain will appear to be a pink color versus the normal grayish white color that it is. And that's usually because without the red blood cells, with them being anemic, the fluid tends to leak out of the blood vessels, and that causes pulmonary edema, and just the blood staining that's leaking out will cause the brain to have that pinkish color. Diagnostic blood and tissue smears with stain, and you can see these funky looking little protozoa. Usually there's 1 to 2 typically in a red blood cell. And they gang up inside those blood cells and basically kill them off. Treatment, there are some antiparasitic drugs which are not very cost effective. Supportive care, blood transfusions possibly, but usually by the time you're seeing clinical signs, it's usually too late. So control would be tick control and trying to figure out how to do that. Clipping your pastures can be one method. Like I said before, the fly tags that you can put in their ears, sometimes that will help keep the ticks from questing and going into their ears. Thyleria is another tick-borne protozoal parasite that infects both the red and the white blood cells. Thyleria orientalis ikeda is the one that we are seeing here in New York. and the transmission is primarily the Ixodes ticks and the Asian longhorn tick as well. Clinical signs, basically everything is very similar to the anaplasma, the babesia, the high fever, the anemia, the jaundice, the weakness. Clinical signs are very similar. It's very hard to tell these three diseases apart. The one thing that they do see a little bit more with filaria is you can see in this cow, the front of the shoulder, there's a lymph node that is extremely swollen, and that seems to be something that is pretty common because it is infecting the white blood cells. So those white blood cells are going back to the lymph nodes and causing the lymph nodes to actually swell up as well. So these animals could potentially look like an animal that has lymphoma, or lymphosarcoma, with the swollen lymph nodes everywhere. Treatment, we know of no treatment at this point in time. Prevention is tick control, the insecticide ear tags. And I guess as a side note, all of the ectoparasiticides in the US, this includes your topical dewormers, topical um, um, the powders, the porons for flies, mites, ticks, anything like that. Everything is extra label use for the Asian longhorn tick at this point in time. And a little bit more about our Asian longhorn tick, which seems to be invading New York State. Um, it is present here in New York, mostly on the eastern side of the state, not as much in the western side of the state where I am at this point. The scariest part about this tick is that this tick can actually reproduce asexually. No male is needed. The females can reproduce and create more babies, live babies, without having a male. Which all of the other species of ticks require sexual reproduction. So they obviously can reproduce a whole lot quicker without having to have a male. They are blood sucking, so besides spreading diseases, they will decrease growth and production and can actually kill an animal due to blood loss if you have enough ticks on the animal. Some of the diseases that have been reported that they have spread are anaplasma, babesia, filaria, along with Ehrlichia, rickettsia, and some other viruses. I wanted to mention some of these other diseases because we do see those in dogs and cats sometimes, as well as humans. So if you see this tick or you have it in your area, just be aware, try to get it off and try to get it identified to see what type of tick it is. And they can actually test the ticks to see what they are actually carrying as well, which can be helpful because you may be able to determine what the tick is carrying before the animal actually is sick enough or has enough bacteria or protozoa in its blood cells to actually come up positive on a blood test. You may be able to determine what that tick actually had if you test the ticks. So trimming your pastures, clearing brush, removing the ticks. If it's on the animal, remove the tick, disinfect that area, save the tick, and you can put it in a little medicine jar or empty medicine vial if you wanted, and a little bit of rubbing alcohol in there to preserve them and give it to the vet, and they can send it in for you if need be. Another disease. Oh, and I was gonna flip that picture. The picture up here is upside down, but you'll notice that when you see the front teeth of the cow are on the top instead of the bottom. Epizootic hemorrhagic disease. This is commonly thought of as a deer, specifically white-tailed deer disease. It has been diagnosed in dairy cattle in New York State in 2021 and again this past fall, 2023. Clinical signs typically include a fever, a decreased appetite, drooling, swollen coronary bands, lameness. On oral exam, you will see erosions and vesicles. And right here, this here was a big vesicle that basically ruptured and is considered to be an erosion at this point in time. There's also vesicles there and right there. Up here is the nostril, and down here is the chin. I have a couple more picture, or at least one more picture to show you on that. One of the things or some of our differential diagnoses why we get a little bit worried about this disease is because it has the same clinical signs as foot and mouth disease does. And foot and mouth disease was eradicated from the United States in 1929. And we hope that it never comes back to the United States. However, on a daily basis, there are reports at all of the border ports that there are products that are trying to be imported into the United States, whether it's legal or illegal, of which are potentially contaminated with foot and mouth disease. So it's a matter of time. I mean, we are relying on our Border Patrol and our USDA Beagle Brigade to keep our borders safe. And hopefully they will continue to do that for a while. Another disease that we do see occasionally that would be on our differential list for lesions like this would be malignant catarrhal fever. Classic history for malignant catarrhal fever is that the animal has a history of being around sheep and possibly goats, because sheep and goats are carriers for malignant catarrhal fever virus, and they do not show any clinical signs. They are subclinical carriers of it. However, it is fatal to cattle. Another couple of viruses are blue tongue virus and parapox virus. Actually, at the fairs last year across New York, some animals were sent home from fairs due to parapox virus, and it was treated as if it was a foot and mouth disease episode. Animals were shut down from coming in, animals were sent home. So it can be a big deal. This disease also has a high mortality rate. So, you know, animals will die if they become infected. And there typically is a subsequent outbreak in the area with white-tailed deer. In both cases, in dairy cattle that we have had in the past few years, there were also wild white-tailed deer in the area that had been affected by the virus. Diagnosis, we typically swab the vesicles. Here on the nose, in the nares, you can see there are some vesicles. These ones down here a little further, starting on the hairline, look like they've popped already. But those are definitely indicators of something not so good going on. We also would take blood either in a purple top or a blue top tube and a red top tube. They do the agarose gel immunodiffusion test on them that can cross-react with blue tongue for EHD, but they can get that sorted out using the serum neutralization test, and that will also help them determine the serotype. Transmission of EHD is typically the culicoides biting midges that come out typically in late summer and early fall. And typically you see these, well, you may not see them, but they come out at dusk and are annoying little pesky critters that like to bite. I'm sure most of us, late summer, early fall, are not necessarily going to put our cattle indoors for the evening, so they don't get bitten by culicoides, biting midges. However, if you were having a EHD outbreak in wild white-tailed deer in your area, it may not be a bad idea to keep your cattle indoors in the evenings during this time frame. Because the only prevention is to limit exposure to the biting midges, and there are no commercial vaccines available at this point in time. So why are we seeing some of these diseases? It's really there, and there's probably more factors than these ones that I came up with, but there's a lot of different factors. Some of it might have to do with some of the climate change that we're seeing, where we're not having as harsh of winters, so these ticks are able to persist, and even um, some of the biting midges, they through their life cycle, I'm sure that they are not getting killed off in the wintertime like they used to. Um, we also have ticks and parasites that have learned to overwinter, possibly due to some evolution. We have issues with people that import animals from other states where the import requirements are not met. So if they have not done appropriate testing, if they're required to test for blue tongue, anaplasma, babesia, any of these diseases, thylaria, sometime from some states, that could be a potential import requirement, as well as having a health certificate as to where they came from. So that could be a potential issue. Having poor beef quality assurance standards, so using dirty needles or dirty equipment. Lack of external parasite control, lack of using products that may help repel the ticks or the flies or even the biting midges. Some of these factors can be controlled, others cannot. And when we're talking about food producing animals, our options sometimes are more limited than other species due to food safety. NISHAP, talking about our protocols and diseases and whatnot. I need to mention the New York State Cattle Health Assurance Program. This is a program that is free to producers. It's a biosecurity program that would include your private vet, a state vet, as well as you and whoever you would like to be on your team. We typically have a yearly meeting and come up with a herd plan that's tailored to your herd. These meetings are typically an hour to 2 hours long, and it will count as a beef quality assurance educational credit. If you ask us, we can definitely sign your form for you to get you credit for that. This can also be a NISHAP if you don't have a regular private vet, because I know they are getting fewer and far between in certain areas. Or you have trouble getting a vet to come out to your farm. Sometimes being on the NISHAP program can benefit you, because that can count for your yearly visit with them, so that they know what's going on your farm, to help with your vet client patient relationship. So you may be able to actually get some some prescription products from them if you needed them. Secure beef supply. We have our secure beef supply module stuff up on the Cornell website currently. And we also have been, many of us have been talking to farms about the secure beef supply and secure food supply. Hoping that we are taking next steps to work farms towards having the proper paperwork in order if we ever get for an animal disease like foot and mouth disease, so that you would be able to still ship your product, whether it be milk, beef, whatever, to slaughter, shipping milk, any of the food supplies that our animals produce, getting you on board with having everything ready for permits and whatnot. It's a very overwhelming process. If you take a look at it, most people are going to look at it and say, no way, I'm not doing this. We do have secure beef supply books that are broken down into a 5-year plan. Year one is basically looking at a map and coming up with traffic patterns on your farm.
Okay.
Pretty simple.
Oh,
Here is my
okay.
contact information.
Oh,
The
here's your
top
contact
number
information.
is our main number in Albany, and the phone number and email below are my direct contact information. I am a field vet out here in Western New York, and I am also serving as the interim NISHAP coordinator.
Yes,
Um,
but what's the problem?
any questions? And I'll pop back to that screen if you guys need that. Do we have any more questions?
Seeing none in the chat box, Dr. Carpenter. Thank you
You're
so
welcome.
much. A lot of great information shared tonight and in great detail, and I do appreciate you pulling together this information to share with us.
You're welcome.
Are there any last minute questions for Dr. Carpenter?
Are these slides going to be made available?
Okay, great question. So I can get the slide set out to those interested in either a hard copy format. Also, tonight's Zoom is recorded, so I will share that link to participants as that becomes available. So you'll have two ways to revisit this information as you need to for future reference. Double checking the chat box. Just a lot of great feedback and thanking Dr. Carpenter for sharing your information. I
Okay,
will
Millie,
also
let's go.
I will also remind participants that next week we have another Zoom program scheduled for you. A lot of you have all quite likely already
Maura, have you combed your hair?
signed up for that presentation. I will put my email in the chat box in case anyone wants to reach out for
I know it
additional
doesn't look like
information.
it.
Okay. Any last minute questions here as our evening is getting on and away from us here? So in my rather in the chat box is my email. If anyone has any questions or follow-up concerns that you'd like to reach out and contact me, I encourage you to do so. I'm always interested in hearing from our beef producers across the state as far as what programming needs they have, what information they'd like to learn more about. So if tomorrow you have some input you want to share, please reach out via email and share those thoughts with me. With that, one final last thank you to Dr. Carpenter for sharing tonight, and I thank you, each of you, for logging on tonight. Have
You're
a great
welcome.
night,
Thank you,
everybody.
guys.
Thank you, Dr. Carpenter.
You're welcome.
Take care, everybody.
Bye-bye.
Bye.